Knock knock. Perform hand hygiene. Hi, my name is Brianna. I'm going to be your student nurse today. So I have the doctor's order on the MAR just to do a Foley catheter on you. I do have all my supplies ready, and I'm just going to go ahead and verify your name and date of birth. Your name and date of birth, sir? Jose Hernandez, 05/01/2000. Mr. Hernandez, before I proceed, do you have any allergies to iodine, shellfish, latex, or any soaps? No? Okay, so I'm going to go ahead and just close the curtain for patient privacy. I'm going to go ahead and just verify the order. We have a Foley catheter for Jose Hernandez. And the reason for doing the Foley catheter today is just because the doctor wants a strict INO. So what that is just we want to monitor how much fluid is going in and into your body and how much fluid is going out to your body, okay? So I'm going to go ahead and perform hand hygiene. I'm going to put on my gloves. Okay, Mr. Hernandez, I'm going to go ahead and just uncover you really quick, okay? And this procedure should take like about 10 minutes. Move this out of the way. And I'm going to move up your gown, okay? Oops. Okay. Okay, Mr. Hernandez, I'm going to go ahead and put this waterproof barrier under you. And also, while I'm doing this, I'm going to make sure I put the bed at a level that is best for me so I won't strain my back. Mr. Hernandez, I'm going to go ahead and clean you, okay? So first, I'm going to get one wipe. I'm going to go ahead and just clean from the top going to the bottom. And this is cleaning. Then I would discard. Then I would be drying, going down. And while I'm doing this process, I'm going to go ahead and just inspect if he has any lesions, any infections, or any drainage. And everything looks good to me. So I would discard that. I'm going to go ahead and just remove the waterproof barrier. And discard this as well. And remove my gloves. So it's going down. And discard that. Okay, so then I would start to get perform hand hygiene. Then I would get my my Foley catheter. And I'm going to go ahead and make sure I open up to the 1-inch borders and not contaminating anything. Okay. Then I would get my gloves, my sterile gloves, place this, and make sure not to contaminate anything, and kind of just break up the membrane. Okay. Then I would get one hand, go ahead and put in my hand into the sterile glove, making sure I don't contaminate anything. And since this one is sterile, I could go ahead and get this one. Perform. Okay, so I am sterile. Go ahead and discard this. I'm gonna go ahead and put the waterproof membrane under him once again. Then I would do like the puppy dog ears and go right under. Okay. Then I would get the drape and put it over Mr. Hernandez. Okay. Then I would prep everything. So I have the iodine, I have the petroleum jelly, and the 10 units of saline. So I'm gonna go ahead and just get everything ready, put the jelly, open up my iodine, have it laid out, and connect. Then I would connect the saline into the catheter. Okay, so I'm just gonna have all that ready just for when I'm ready to do it on Mr. Hernandez. Mr. Hernandez, I'm going to go ahead and touch you, okay? So then I would grab him. I would go ahead and get the iodine swabs. There's 3 in here. Go ahead and clean from the top going to the bottom and make sure that I keep this hand in the same place and I do not want to contaminate anything. Get the second one, clean, discard. Get the last one, clean and discard. Okay? This is when I would go ahead and get the catheter, put it into the jelly, and discard that. Put that out there. Okay, Mr. Hernandez, I'm gonna go ahead and put the catheter in, okay? So I'm gonna go ahead and insert 1, 2, 3. You might feel a little pressure, okay? So gently just go in. And then I'm gonna hold. This is when I would do the 10 units of saline, and this is gonna inflate the balloon. Discard. Okay, so the balloon is inflated. Go ahead and discard this. So what we're gonna do is gonna just kind of come out as it's sitting in the penis, and we're gonna see the balloon. So that's what it's gonna hold. Then what I would do is I would tape the catheter on his leg, and then go ahead and just put this on the side of his bed. You want to make sure that you're not doing it on a bed rail, or making sure that nothing moves, just because you don't want it to pull out. That could be very, that could hurt the patient. So I'm gonna go ahead and I would start removing everything, all my supplies. For the sake of the video, I'm just gonna keep this on. Okay. So then I would remove my gloves. Okay, and then perform hand hygiene. I would lower down the bed to back to normal, and I would just tell Mr. Hernandez that to tell us when he has his first void. Make sure that if he needs anything, do the 5 Ps. I would see if he needs to go to the restroom, if he's in any pain right now, if he's in a good position, his personal belongings is in reach, his call light, and then I would just see if there's any IVs or pumps that are in his way. Then I would perform hand hygiene one more time and thank Mr. Hernandez for his time. So after this is going to be 3 days later. I'm going to go ahead, I'm going to be removing the Foley catheter. So I'm going to just put this back on him just for the video. I would knock, perform hand hygiene one more time, and state my name again. Hi, Mr. Hernandez. My name is Brianna. I'm going to be your student nurse today. Today I have a doctor's order to remove the Foley catheter. Can you verify your name and date of birth for me? Jose Hernandez, 05/01/2000. Okay, Mr. Hernandez. So we are going to remove your Foley catheter today. So then this is when I'm going to do hand hygiene one more time. Put my gloves back on. Okay, and then I would go ahead and grab the bag. So this bag would be on the side of his bed. I would empty out and measure how much urine is in the bag. I'm going to go ahead and uncover you, okay, Mr. Hernandez? And do you have any allergies to any latex or anything? No? Okay, perfect. So I'm going to go ahead and take away his cover. Okay, Mr. Hernandez, I'm going to go ahead and disinflate the balloon. So I have the balloon here, or the syringe here. I would insert it. And as you can see, the balloon is stuck into the water bottle here. So you're gonna pull back, get all the saline back in there. Okay. Saline is out. I'm gonna go ahead and remove the catheter, okay, Mr. Hernandez? So I'm gonna pull it out, and I would discard of that. So then I would be done, remove everything away from him. Okay. Okay, Mr. Hernandez, you are all set. I just want to tell you, you need to notify us when you have your first void. We just need to make sure that everything's working properly and everything's fine. I'm going to go ahead and just do the 5 Ps again. Mr. Hernandez, are you in any pain right now? No? Are you in a good position? Do you need any pillows? No? Do you have your personal belongings next to you? Are you okay? I'm just gonna check for IVs, pumps, or anything, and you look like it's all fine, no pain. I'm gonna go ahead and I would be done with my Foley removal. Go ahead and thank him for his time and do hand hygiene. Thank you, Mr. Hernandez, for your time.